All right. All righty. Seeing my opening slide there, everybody?
Yes.
Okay, awesome. Well, thank you for inviting me to your meeting today. I'm Deborah Radi. I'm the Assistant Division Director for Emergency Preparedness and Response at the Minnesota Department of Health. And so I have been working in some type of emergency response most of my career. Prior to the health department, I was working as a regional EMS coordinator in the metro region. And prior to that, I worked many years for the American Red Cross. So lots of years of disaster response. Today, what I'm going to do is just provide you with a high-level overview of emergency preparedness and response for public health. Kind of what we do to prepare and how we respond. And then because of some question Taylor asked me, so hopefully I interpreted it right, I'm going to end just talking about a little bit how we push out information from the health department. So and then certainly open to any questions you have at the end. It's not a real long presentation. So let me make sure I'm on the right screen here as I go down. All right, so the Minnesota's public health system is best described as a state and local partnership. We have the State Department of Health, MDH, Minnesota Department of Health, and then we have 51 what we call community health boards in Minnesota, which comprise of one or more county public health agencies that are working together as a unit. And so within statute, the Minnesota Local Public Health Act, it identifies specific responsibilities of MDH and as well as of city and county governments for planning, developing, funding, delivering public health services, of which disaster response is one of those. And so we really work as a partnership with our local public health. And you'll see that as I go through the slides, how we work together. But the key thing is both of us have statutory responsibilities and authorities. One of the things is that we've really been working on how to sustain local public health emergency preparedness and response. Right now, we're primarily funded that program area by the federal government. And we've been seeking, we're hoping some state funds for the first time to help with sustainability. And partly why we are looking for that funding is so we can build more resilience and flexibility in our ability to meet emergencies and really continue to work on partnerships across the board. So when we think about my division in particular, our role in this whole program area focuses on preparedness, response, and recovery. So in the preparedness area, what my staff focus on is building and strengthening both MDH abilities and local abilities to effectively, respond to a range of public health threats. So that include infectious diseases, natural disasters, and any other kind of biological, chemical, nuclear, radiological event. So we plan for all of those, and how we prepare is by writing plans, so response plans. We tend to write what we call an all-hazard response plan with then specific added information for kind of specific threats like a pandemic or an anthrax attack or a nuclear emergency. And then we provide training through workshops and courses and exercises to help all of us prepare. And the goal of preparedness then is when it's time to respond, we are able to rapidly respond to whatever emergency faces us at the state level, as well as then provide support for local public health response as needed. And then recovery is really a community event, because when we get into disaster recovery or public health emergency recovery, it's really collaborations at the local level, with their community partners, helping people recover. Tribal public health, we work with healthcare partners, and then state agencies. So we're all kind of part of that recovery effort. And so in addition to local public health, we do also work with our healthcare agencies through the hospital preparedness program, which is part of the emergency preparedness and response division. And this program supports regional collaboration among for healthcare preparedness and response through healthcare coalitions. And there are 8 healthcare coalitions in Minnesota. You'll see there one in each sort of region of the state there on the map. And these coalitions really pull together all sorts of healthcare partners, hospitals, long-term care, emergency medical services, pharmacies, public health is part of the coalition. And the interesting thing about the coalitions is that they are, during preparedness and response, able to often incentivize those competitive healthcare organizations that have different priorities and different objectives to work together when something happens, so that they can support the people in their regions. And the coalitions, as do with healthcare agencies, what MDH does with local public health, which is support them in writing plans, helping with trainings and exercises so that they are ready to go. So to give you an idea of the types of things we respond to, oops, I skipped one. I'll get to that in a minute. I think the other thing that we always like to point out is that all responses are local. And so I'm just gonna page up here to see if I skipped a slide. Oh, I lost my slide with my little chart on it. Bummer. I'll show you, I'll talk about it in a minute. So all emergencies are local, and many of them are shared responsibility. And so some of the types, I'll maybe when I show the website later, we'll point out the types of responses that we have. But when we look over the last 12 years or so of responses in Minnesota, as you all know, 2020 was the year that COVID started. And actually at the health department, we are just winding down our COVID response to low gear through the summer, kind of waiting to see what fall happens. And then hopefully by the end of this calendar year, really be able to completely close down the response part of COVID and ongoing activities to support COVID vaccinations and getting tested and treated. Will move into normal healthcare work, as well as normal work at the Minnesota Department of Health. But while we were responding to COVID over the last couple of years, we also had a measles outbreak. And then last year we had the Mpox outbreak response as well. But going back a few years, over the years, we responded periodically to flooding. This year we were monitoring the flooding, but didn't have to respond. The state health department usually gets involved when healthcare facilities are impacted. You think back to, I think it was 2011 or 12, prior to a lot of the mitigation in the Red River Valley, there was a large nursing home on the Moorhead side, the Minnesota side of the river, that needed to evacuate. And so the health department got involved in that and coordinating with EMS and finding an alternate care site for those residents that couldn't be moved to other sites. So we get involved with, or if there's recently there was kind of a bad day in long-term care. One had a pipe burst, another one had a small fire, and I can't remember what happened at the third one, where they all had to do, personally it was smaller units, some kind of evacuation. And so our health regulation folks kind of support to make sure the patients are taken care of. Lots of infectious disease things over the years. It seems like about every 3 or 4 years, we have a measles outbreak somewhere in the state requiring a response. And then we also had Zika planning We also respond to special events like the Super Bowl. Health Department was part of that planning. We were on for all of those events as well. And then the other kinds of things you don't think about are continuity of operations or continuity of business responses. Back in 2014, a pipe burst in our public health lab, requiring the relocation of some of the lab area and replacement of several very large, expensive machines. And then anytime there's a threatened shutdown at the federal level or the state level, we go into response to determine what are the priority services that must continue even during a shutdown. So when we're preparing, I just wanted to share this. We are funded primarily by the Center for Disease Control, and they have provided some standards for public health preparedness and response. They're called the Public Health Emergency Preparedness and Response Capabilities, of which there are 15 of them. And so we are working with not only at the state level, but with all of our local partners to build capacity in each of these areas, or to have access to the ability to respond in each of these areas. And this document provides us with a comprehensive planning framework. It specifically identifies preparedness and response roles for public health. It offers suggestions for collaboration and evaluation. And so because it's a national framework, each state has to make some adjustments based on how we're organized as a state. For example, in the capability on fatality planning, mass fatality planning, in Minnesota, we don't have a state medical examiner. So lots of mass fatality planning, fatality management starts locally and with the medical examiner coalitions. But in other states, it's a medical director who does that. So that's one of the things that's going on there. When we respond, I'm kind of moving from preparedness into response now, we follow the National Incident Management System, or NIMS, and we do that by setting up incident command staffing and a staffing structure where we identify an incident manager, and then we always identify a public information officer. Safety officer depends on the type of emergency, and same with a liaison officer. Operations would be, so if it's an infectious disease, a lot of our epidemiologists and other staff working in that area would be in operations. Planning is a critical role in incident management, having somebody to make sure that we're documenting what we're doing, providing situation reports, making sure we have resources, along with the logistics chief, and then somebody to track finance and administrative information. So this is kind of a standard framework, and we build it out. During COVID, we had lots of subsets under each of these categories for a response. But if it's a small response, we may not even staff all of these areas. The other part about when we go into response is, as I mentioned, it starts locally. So if the locals, if the ability to respond to an emergency exceeds local resources, then through their local emergency manager, they reach up to the State Emergency Operations Center. And the State Emergency Operations Center may ask MDH to sit at the table with them if it's a public health related emergency, or we may be asked to come and participate to provide resources. But they are the hub for state agencies and other partners to support local governments and coordinate work. And so actually right now, during this time of flooding over the last couple of weeks, the State Emergency Operations Center has been activated they have different levels of activation, but at a lower level in order to provide support to local emergency managers, either through Minnesota Department of Transportation resources, or other state agency resources to help with maybe closing roads and signage and that kind of thing. So again, sometimes they operate with just their own staff coordinating resources, and sometimes they pull in other state agencies as well. When the state, if it's a large enough disaster, when the state EOC is open, they may choose to establish a joint information center or JIC. During COVID, there was a JIC in place. If it's any large disaster, a lot of times they want to coordinate one sort of communication path between with all the state agencies. And so all official news about the state agency response then moves through the JIC, and every state agency has a public information officer that is working at the JIC and coordinating responses. And then they'll do news conferences from their media room at the Minnesota Department of Public Safety, and publish their numbers for reporters to reach out to instead of going to individual agencies. During COVID, the SEOC Joint Information Center was open and operating. However, because it was a large public health emergency and we were in unified command with the SEOC, we also had our own communications happening at the Minnesota Department of Health. So in looking at communications, I just wanted to point out a couple things. This comes out of capability 4 and those capabilities that I mentioned. And really what we're working at the state to continue to develop is our ability to develop, coordinate, and disseminate information, alerts, warnings, and notifications to both the public and incident management personnel. And we're really helping local public health develop these capabilities as well. And a big focus from CDC is to be able to identify and reach populations at risk who might be disproportionately impacted by incidents or have limited access. And so we really, we had some ability at the State Department prior to COVID, but we really ramped up our ability during COVID through a variety of ways. One is we contracted with different media groups that worked with specific populations at risk. We put out information in other languages. And then we set up a public hotline. We had a small hotline going starting the end of March, but by April, we had a fairly extensive public hotline going. And that we now call it a public inquiry line, and that is still operating, although the hours are reduced from what's on the screen here. And we are looking at transitioning that line from a COVID response line to continuation at MDH because it has supported other responses. So for example, when we were doing a lot with when MPOX first was in the state and there was lots of information requests, the public inquiry line / hotline was provided information to respond to that as well. And one of the things that we're training all of our public information officers and working with local public health, really what we want to do for crisis and emergency risk communication is to make sure we have the right information and we get it to the right people at the right time so they can make decisions. And as you probably all know, that was very challenging during COVID because information was changing frequently and making sure that our messages stayed up to date. So in closing, I'm just going to click on, so if you want to know more about what's going on in the state health department, I really encourage you, I'm going to go to the homepage first, to go to our website, which is very extensive. And so we always have up in this upper left-hand corner, kind of what kind of key areas are. And you can see COVID-19 is still there because we are still putting out situation updates and information on COVID-19 response. So when people want to know more about, what's the case count, what's vaccine data, they can go to our situation update page. It says what the community level, you can track what the community level is by state and county through the CDC. And then we locally have information on all of these areas. So for example, if you're interested in hospitalization and capacity data, there's some verbal information, but then there's lots of graphics that show what the current hospitalization rate is, and then what the ICU count is. And this is for COVID cases only. And then if you want to look at hospitalization rate by county of residence, there's a chart. So there's lots of different information that you can find on COVID data. Sometimes people, I'm going to go all the way back here, are interested in, information on vaccine, or they want to know where to get tested or what to do if I test positive. There's still a lot of information about that. So it's all good in terms of information there. So COVID, is a good source, as well as we had a link to floods. And then we also have, if you look for, I'm looking for emergency response. I'll do preparedness since that popped up for me. You can come to our page for our division. And so here we've got information on all the different programs that we have: our disaster behavioral health program, our medical countermeasures program, has some information on our plans, all of that, as well as our medical surge information. So let me just close this. So with that, that's really all I had to share today, but I'm certainly willing to open for questions. So let me stop sharing this so I get back to the page. Thank you. Any questions? All right. Well, if not,
I'll pose one quick.
Yep. Sorry, go ahead.
I'll pose one quick.
Yep.
Without getting too political, because I know there is a subtext whenever this gets invoked, but what sort of lessons learned do you think have come out of this pandemic that we've just gone through? What are the kinks that can be worked out amongst all of us?
I think the things that we are focusing on kind of are in a variety of areas, but I think one of them is a lot of the kinks that we had early on were capacities we didn't have in place. So things like translation services, like right away, things like I think trying to have a more coordinated communication. I think COVID was a little unusual because of the level of political oversight by the governor's office, not only in Minnesota, but in all states. So one of the things that made COVID a little challenging is I talked about our incident management response, which works really well for something that runs a few weeks to, a handful of months, but for 3 years, that model was challenging. And so we were kind of partially doing that, partially project management. So really looking at how we can better coordinate. And we're working right now with our local public health partners to build upon those processes that we developed during COVID that worked really well and keep them going. And then those that don't. And I think one of the things that really helped us at the state health department was the ability to quickly increase the amount of data that we were able to put on our website. That was very helpful. And then also, I think developing a stronger relationship with our healthcare partners on how we can support them. I don't know, I think continually trying to fight miscommunication, although I think that's some respects a losing battle. So all you can do is keep putting out your information and hopefully it connects with people at some point. Internally, I think when we look at where we want to improve our internal response, I think it really is in having strong sort of planning chiefs to direct the whole response. We had lots of people working on pieces, but we could have been better coordinated as a whole sometimes. Sometimes we are kind of bumping into each other or doing extra work. And I think we're really working hard to not do that. And I think support our local public health. Some counties, they were, their work was welcomed and encouraged, and other counties, they could do what they could do. So it kind of varied. But But right now, I think, we're moving forward and we're looking forward to doing, I think, lots of different things together. So.
Cool. I will have you quickly transfer hosting capabilities back to me so that I can hand them
Sure.
off to Andy.
All right.
Just fighting with my cellular service. So before anything messes me up, I better hand that off quick.
All right. There you go.
Okay. Eddie, I'm guessing you want me to transfer it over to you as opposed to Tiffany?
Yes.
All right.
Yes. Tiffany's on her phone.
Got it. Here we go. Floor is yours.
And now I got to remember how to do this again.
The lighting is pretty darn bad. Can you get either the light off from above you or something in front of you? It's
Yeah, I'll
hard.
turn the camera off here. I'm sorry. I got a face made or head made for radio anyway.
Oh, well, that's a lot better.
Can you see my screen now?
Yes.
And is it the full screen one or?
Sure looks like it. Maybe a little postage stamp, but yeah, I see the whole slide in full slide mode.
It looks good to me.
All right, so good afternoon. I'm Eddie Murphy. I'm with the U.S. Department of Transportation Pipeline and Hazardous Materials Safety Administration. I'm the emergency response liaison, and I work at the headquarters in Washington, D.C. On the phone, we have Tiffany, who works in our Central Region office. Tiffany, did you want to say hello?
Good morning, everybody. My name is Tiffany Ziemer. I'm the chief investigator for the 11 Midwest states, and we are all remote. So I actually work out of my home in Minnesota.
So, thanks, Tiffany. So today I just wanted to kind of give you a brief overview or of who we are and what we do here at the Pipeline and Hazardous Materials Safety Administration. If I can get this to cooperate. Sorry, it was working. Can't get the slides to advance. All right. Is that are you seeing that now? Is it or are you also or am I sharing the one with the notes and things at the bottom?
Still on the first like introductory slide. Don't know if that's what you're after or not.
Yeah. Yeah, I apologize. Here we go. This will work better. There we go. All right, now I'm good. So,
Yep, much better.
who is PHMSA? As you can see, as I said, that is the headquarters building in Washington, D.C. There are 9 operating agencies that make up the Department of Transportation. One of them is the Pipeline and Hazardous Materials Safety Administration. And as the name implies, there are two offices within PHMSA. One is the Office of Hazardous Materials Safety, and one is the Office of Pipeline Safety. We have 5 regions and multiple regional offices, and we also have investigators and inspectors who are posted remotely throughout the country, such as Tiffany, who was there in the Minneapolis area. So this is the map of our regional offices, and Minnesota, Wisconsin, you fall under the central region, which is the central region office is in Kansas City, Missouri. This is the PHMSA's mission. I'm not going to. You can all read, but so I'm not gonna go through this, and I will be blasting past some of these slides quickly, because I don't necessarily believe that they're of a whole lot of interest to the audience today. But so first of all, we'll start out with the Office of Pipeline Safety. As you can see, I did want to let you know. So PHMSA, we do not we have no we are not responsible for where pipelines get built. We are not what pipelines get built, the route that they take, the right of ways, things like that. That whole process is done by a different federal agency, which is called FERC, and also with the state and local municipalities. They're the ones that have the say so on whether or not a pipeline gets built. But once those decisions are made and construction begins, we do have oversight on construction, and certainly once a pipeline, whether it be a liquid pipeline, which transports liquid fuels, or a natural gas pipeline, or other, once they are operational, we do have jurisdictional authority on those, with also pass through to states. Minnesota is one that also does inspections for their state. This is a map of these are large transmission pipelines that are, and this map is 5 years old, but as you can see, the blue are gas transmission pipelines. Red is hazardous liquids such as crude oil, gasoline, diesel fuel, jet fuel. So this is just some statistics on the on pipelines, and this was current as of June of last year. Every year we go out, their pipeline operators are required to submit the information. So that a new one will be coming out in June of this year. But you can see here are some of the number of miles, and again, particularly for the gas the gas pipelines, it does not include the distribution lines. These are large transmission lines, basically from city to city or state to state. It does not include the smaller transmission that for instance, the line leading up to your house is not included in this mileage. One call, I'm going to skip that one. So there are pipeline emergency response initiatives. I do know that that Minnesota was looking to put together a Perry initiative. James Kelly is the point of contact for Perry. And I will also have some information on the other pipeline community liaisons in the central region for you. Pipeline grants. We do have as it shows here, we do have grants that go out, and here are some of the grants that are available to state and local municipalities. We would encourage we encourage those that are eligible to apply. And there's I do believe that that the large one, apologize for this, is that that was $250 million per year over 4 years that came under the infrastructure bill, is not included in this because it was not for fiscal year 2022. If you want more information on what is in your area, you can go to the National Pipeline Mapping System. This is available to there are two sides to the National Pipeline Mapping System. One is what's called Public Viewer. Anyone can view the public side, and you can see the pipelines that are in your area. The other half is password protected and is for first responders. You have to be a first responder or have a need to see the password protected side of it, and you'll be vetted, and you will be given the access level that's appropriate for your work. For instance, if you're a local firefighter, you would be given access at a county level. If you were with the state Department of Health, you could be granted access at a state level. This is a little bit more on the this shows the actual pipeline mapping system, what it looks like on one of the views when you pull it up, and some of the information that's available. The blue line would be a natural gas pipeline system, and the red line there that you see in the middle is a hazardous liquid pipeline, and this is in Charleston, South Carolina. Again, some more pictures of pipelines. This is in South Carolina and North Carolina. And there's the National Pipeline Mapping System. I think I've beaten the National Pipeline Mapping System to death. Some of the again, rules and regulations are written by the Office of Pipeline Safety. For more information, you can click that QR code there to find it. Currently, some of the things that rulemaking proposals that are they're being worked on that may be of interest to you are the CO2 pipelines, particularly in the in your area in Iowa. There is a public workshop that's being held in Des Moines, Iowa, to solicit input on CO2 pipelines, and I believe that the date on that workshop is May the 17th. Again, some further information. Here's some of our websites: the Office of Pipeline Safety laws and regulations. You can also get interpretations, and there's links to the electronic code of federal regulations.
I got a question.
Absolutely, go ahead.
It has to do with CO2. Who uses CO2? What's the story?
That's it is um
It's carbon dioxide.
it is they're taking some of it is pipelines to so it goes back into the ground. It's the carbon dioxide from whatever a byproduct of manufacturing and things like that that is then put into a pipeline to be either utilized in a different uh process, or it's being injected deep in back into the ground. And some of it, I believe Iowa is because of the ethanol plants that they have there. But I am not an expert on CO2 pipelines, and it's all it's relatively new. Regulatory relief during emergency disasters. What this is saying is that during certain disasters, typically it's hurricanes, perhaps wildfires, that TIMSA has the ability to waive some of the requirements. For instance, what I mean by that is if after a natural disaster, there are crews that come in from out of state to help repair certain infrastructure and things like that. In order to be according to our regulations, to work on a pipeline, you have to be drug tested. When we're bringing in crews in from out of state or even out of the country, Canada, for instance, we're able to waive that regulation that they need to be drug tested and trained in that specific system and have qualifications, because it is an emergency, and it's more important to get these systems fixed, and so that's what that is. As I said, so here's the information for the central region. Angela Pickett and Sean Quinlan are the community liaisons for pipeline safety. They're great resources and great people to work with. And so if you have further questions on pipeline safety, please feel free to reach out to Angela or Sean. And here's a general contact for the Office of Pipeline Safety. That's here in DC. All right, so now we're going to switch gears to the Office of Hazardous Materials Safety. So as you can kind of see in this picture here, the Office of Hazmat Safety, here are some of the things that we do. So let me see. I apologize. So basically, or not basically, but yes, it's the simplest way to put it is that the Office of Hazardous Materials Safety, we regulate the package that has hazardous materials are moved in other modes of transportation besides pipeline, whether that be over the road in trucks, by rail, and also by air. As you can see here, so these cylinders that these are cylinders, and I believe this is a cylinder requalification facility. So the cylinders have to meet certain standards and testings, and we are the Office of Hazmat Safety is responsible for the regulations that and how these packages are designed and tested and utilized, and also markings and things like that. Tiffany, did you want to help me out here, please?
Sure. So I'll apologize. I'm actually out in the field training 2 of my new investigators this week. So I'm sitting in the car taking the meeting from my phone. But just to explain a little bit more about who we are on the OHMS side, the Office of Hazmat Materials Safety side, and in particular the enforcement side, our agency writes the 49 CFR, and we also write the emergency response, that little orange book that Eddie had just had up on the screen there. Our agency writes the special permits in a situation for emergency management or preparedness. We will write, it's our agency that will write and grant a request for a special permit to say move infectious substances, hazardous waste, or something that needs to get from one point to another that's not necessarily following the regulatory guidelines, but needs to nonetheless happen in a safe way. We saw that a lot with COVID. We've seen that in times of issues, whether it was the swine flu, the bird flu, or we needed to safely transport vaccines, whatever the case is, our agency grants those special permits. We also write the interpretations to the regulations. So if there's somebody out there that doesn't understand a regulation, or it's kind of gray for an area, particularly to who they are and what they do, you can write into our agency, and we have a whole team that's dedicated to interpreting those regulations. We also have everything from engineers to chemists to botanists to economists on staff to make sure that whatever section of the regulation applies to those companies, we have some sort of subject matter expertise in that field to help either write those regulations or decipher those regulations. It may be a little bit surprising, but there's approximately 3,000 hazardous materials that we write and hazardous substances that we regulate too. And there's approximately give or take 1.8 million shipments of hazardous material that go through all of our backyards each year. And that covers everything from limited quantity, where it's your aerosol cans, or something non-bulk, which could be a can of paint, all the way to a drum. Then we have large bulk that is usually about the size of a tote or an IBC. And then anything above that we consider large bulk, which is like your cargo tanks of gas, filling up the underground storage tanks at your holiday gas station or something like that. What our team, the investigators, what we investigate and inspect to our manufacturers, our real bread and butter of what we are in the field is we're the package manufacturing experts. So those who manufacture that cargo tank, those that manufacture that rail car, those that manufacture the box, the drum, the IBC, we regulate all of them. They get approvals to manufacture those packages at a United Nations standard from our agency. We also do cylinders. So your oxygen cylinders, your propane cylinders, those all get approvals not only to manufacture, but to remanufacture or recondition. And for cylinders, we go international as well. So if you're manufacturing a UN cylinder, we go to conduct those inspections anywhere it's being manufactured, if it's getting a UN marking on it as well. Right now we have less than 40 investigators across the country that do what we do. And typically it's a second or third even career that people step into the hazmat world. Really, it's a joke that nobody grows up thinking that they're going to do hazmat. So by the time they retire from the military or the police force or the hazmat industry, they'll come over to this job and start another career being a hazmat investigator. We also regulate companies, industries such as the ASME, that's your home storage propane tank that if you live out in the country, that's in your backyard, or the ag industry, where farmers get a lot of exemptions from our regulations, but the ag industry with the nurse tanks when they're out spraying the field, those aren't necessarily what we call UN packaging, but because the hazardous material goes into them, they fall under our regulations. And so we regulate those industries too. In addition to our inspections and investigations that we do, we also respond to incidents and accidents depending on the level and the severity. Again, there's not a lot of us that do what we do. So we are always spread really thin and participating as much as we can. Each mode, whether it's the Federal Railroad, Federal Aviation, the Coast Guard, or Federal Highway, each has their own pocket of hazmat specialists, but they'll usually defer to us when it comes to the hazmat expertise, especially if there's an incident or accident, trying to determine if it was the package that failed and caused the accident, or if it was the accident that caused a package to fail. Therefore, say a train goes off the tracks and it skids across the earth and then goes and spills into the Mississippi River. Well, that wouldn't be the package failing. Therefore, the package did exactly what it was supposed to do and keep it safe during normal transportations. It's also very important for us to maintain our fluid and ongoing relationships with our federal, state, local, and even industry partners. For example, working with the FMCSA, kind of like I was talking about, if there's something that occurred on the highway, or working with our federal railroad partners. So if there's been multiple train derailments this year. So we partner with our FRA partners. We partner with those on scene like the NTSB, and we go in as a subject matter expert for that specific hazmat and the hazmat packaging. We also work closely with our industry partners, keeping safety in mind. So, for example, this last year, Minnesota required all to a certain level that all Minnesota railroads exercise at least in either myself or one of my close to all of them that occurred last year, and their discussions. We evaluated them on how they used their emergency response plans, and we provided feedback. And that provides us a really unique opportunity to give a lot of feedback, especially to the smaller railroads, where if you got the big dogs like a BNSF or a UP or a CN, and they have almost endless resources to provide safety and training to, that gives us an opportunity to turn around and provide that same feedback to a smaller railroad that might operate only in Minnesota or Minnesota and Wisconsin. A last good example is the propane industry. In the Midwest, obviously, we have a lot of propane, agriculture industry, and hydrous ammonia. And for our Midwest states, there's almost a co-op. You can't go too far without running into one of your farmers' co-ops. And it's this time of the year that I prioritize these relationships across our states. And we do that by either conducting inspections, either before, especially those anhydrous, because if I'm sure most people being from Minnesota know that anhydrous isn't extremely dangerous. If you get caught in a plume of anhydrous, whether you're out plowing your fields or someone's taking their nurse tanks down the road and there's a hose breaks off or they didn't close a valve, if you get caught in that is very deadly. It will kill you, and it will kill you very quickly. So we focus on that this time of the year. So and like I said, we do that by inspections, whether it's right before these nurse tanks go out into the field or when they come back. They operate and work in the fields not only in the spring but also in the fall. So we pay attention to them at that time too. And in particular, that I've personally, as my own priority, I take this time of the year and I stay involved every year with their associations, whether it's the Minnesota Propane Association or the Midwest Propane Association. Last week I was in Nashville at the National Propane and Gas Association, and we're out there giving them presentations to the companies and the industries across the board. So that's kind of in a nutshell who we are and what we do. It goes from everything from pre-transport, before you put a hazardous material into transportation, all the way through when it's delivered to its final destination, and anything in between that could happen, including the manufacturing process and the remanufacturing, the reconditioning, and if there's an incident, an accident, and how we follow that all the way through and then hand it off to maybe a subject matter expertise like the National Transportation Security Board, if it's large enough. But yes, that's basically, as far as the enforcement team, and specifically in the Midwest, that's who we are and what we do.
Thanks, Tiffany. Thank you. Questions for Tiffany? All right. Similar to the Office of Pipeline Safety, the Office of Hazmat Safety also have grant funds that are that we basically those funds are for the for hazardous material emergency preparedness. And as it says, it goes to states, territories, and tribes. So your state will get a if they apply, which all 50 states do apply, will get do get funds allocated to them by us based on a formula, and that is for the training of first responders, and there are also some other supplemental grants that are also for other training and research. Here's a couple of our initiatives. As Tiffany mentioned, the Emergency Response Guidebook. We're responsible, all along with Canada and Mexico, for putting out that Emergency Response Guidebook, which some of you may have seen. It comes out every 4 years, so we are currently working on the 2024 edition. And there's also we also have a mobile app that is available for both Android and iPhones. Also similar to the Office of Pipeline Safety, there are Tiffany mentioned the special permits, and there are waivers that are available during or in the aftermath of the natural disasters, presidentially declared natural disasters. So if you have questions, the specific to or you need assistance, there's the DOT Crisis Management Center phone number, and or I can't imagine anybody on this call would necessarily be looking to for a special permit, but there's the phone number just in case. And for more information, the Hazmat Info Center is available. They're more than they're the ones to call if you have questions regarding the Code of Federal Regulations that we have for the transportation of hazardous materials. And so here are here's the Hazmat Safety Assistance Team. Dan Richards, who lives in Michigan, is your community liaison in the Central Region office. Dan had a prior commitment today. Otherwise, he would certainly have been on this call. But I believe that's what I've got. Yeah, that is what we have for you. I'm happy to answer any questions. Stunned silence or overwhelming silence.
Thanks for your presentation.
Taylor had to run off to another meeting, I believe. So I just wanted to say on behalf of Taylor and all of us on this call, thank you very much for your presentation. We really appreciate it. It's been very informative.
You're welcome. You're welcome. Now I just got to figure out how to transfer this back to you.
Well, I believe there's at the bottom is the share screen button. Otherwise, I believe that I don't have any further announcements. I think that we covered most of what we needed to at the beginning of the meeting anyway. So I would say thank you presenters, and I need to run off as well. So we can call it a meeting. Mark, thanks for recording this for us.
Well, there's still photos. Do you actually have the video to go with it?
I do not.
Oh. Taylor
Maybe
usually
that's something Taylor started.
Yeah, Taylor usually does that. Not in my bag of
Okay.
tricks.
Well, I see the little recording light is still going on the on my screen, so he must still have it somewhere.
Mm-hmm.
All right. Well, again, Eddie and Tiffany, thank you for presenting, and we'll see all of you later. I've got to run off.
Very
And
good.
thanks.
Thanks, everyone.
Thanks again. Have a good day.
Bye-bye.